Good afternoon, Rocky. I'm so glad you're back today. Hi, I'm Dr. Wong.
I'm Jamie.
Nice to meet you. Well, I have some great news. I went over your exam from yesterday, and I have treated many patients in the same case that you have, and they've come out with great results. But before I get started, I wanted to talk a little bit more about what we talked about yesterday and see if you had any questions about what we went over.
You said something about a subluxation.
A subluxation? Yes. A subluxation is a misalignment or bone out of place in your spine. So if this was out of place, twerked or twisted in a different way. And what that does is that when it's misaligned, it interferes or interrupts with the central nervous system that connects your tissues, your organs, and your muscles throughout your body. Did you go over anything with Jamie yesterday?
A little bit.
A little bit? Did you have any questions, Jamie?
Are spines usually that curved? Is that a normal spine?
Well, this is not an exact replica of a spine, but this is what it looks like in the human body. And yes, there are curves in our spine that we use for normal degrees. So we try to get everybody's spine to look like this, that has the normal curvatures. So when I went over your report findings, you complained about back pain. I also found that you had some subluxations in your neck, which is the upper part of right here, and then the muscles that connect your neck to your mid-back, there's a big group of muscles called erector spinae muscles, and those muscles help with your posture for like extending your back and for standing up, and it actually helps your head go to the correct spot throughout your from your spine. And what I found is you have a subluxation on the left side of your neck, which is causing the range of motion when you laterally bend this way. It's not the normal range. The normal range is actually 40 degrees, and your range is at 25. So we'll go ahead and adjust that and correct that subluxation. But as far as your low back pain, the muscles that connect from your neck to your back are on one group, and the tension that is pulling on that is from your neck, and it's causing as well your sacrum to be higher on one side than the other, and that's what's most likely causing your hip pain as well. So once we go ahead and adjust your low back, it should correct the problem in your sacrum.
Right.
Yeah. So I will do that, and I also would like to do some physical therapy work on the muscles, so it will decrease the spasms in your low back. And I also want you to I'll give you some exercises to do to help strengthen your back and your neck muscles. But you have to promise me that you will do them at home, because in order for me to do my job, you have to do your job, or the treatment won't work. You understand? So I would like to show progression throughout every treatment, so I can show you how much progress you've made with the adjustment and physical therapy and so forth. So I'll do this 3 times a week for 4 weeks. And the adjustment, each time you come in, it'll be $60, and that includes the physical therapy. And if you didn't have any questions, my goal is to reduce your pain and allow you to do your daily activities as work and rock climbing. So if you don't have any questions, I'd like to get started today.
Sounds great.
Okay, let's go.